My name is Paul Sebring. I'm originally from Arizona. Pre-earthquake, I was a fashion photographer, did a lot of editorial work working with magazines and a lot of celebrity work. And the earthquake that hit Haiti on January 12th, when I saw the news reports, when I was on my computer, it really impacted me a lot to go help. And I was in country about 10 days later. Nobody was going to support me in it, in the sense of the large NGOs. They basically told me I didn't have any experience or anything like that, so just to send money, and I wasn't going to do that. So got my own ticket to Dominican Republic, worked my way in, and found Haitian Community Hospital, where I started to volunteer there, and that's when I ran into little Paul. We've been in Haiti minus about 2 weeks, 2.5 weeks that I left between February and March. Was there until the middle of September, minus 5 days, and little Paul's, he's still there, and I'm heading back on Sunday. M.M.R.C stands for Materials Management Relief Corps. Our primary focus is establishing clear lines of logistical support in disaster areas. We noticed in Haiti that there was no organization to the medical supplies that were being dumped in country. So our mission is to, find those supplies, get them organized, get them to the people that need them most, and make sure that, no one does without. M.M.R.C was formed during my break between February and March, that 2.5 weeks I was home. Initially, when I did come home, I pretty much was not going to have anything to do again with Haiti. I was burned out, I was exhausted, I was PTSD'd, and 48 hours after being in Arizona, I looked around and I was like, I'm living an ultra-privileged life and there's people out there dying. I communicated with little Paul. He was going to be back in the States for about 10 days for a break. I formed M.M.R.C, and he and I are the co-founders of it. And from there, when I went back, is when it really took off, the work that we were doing, because we weren't associated with a hospital that we'd been working at, and now it was our rules, our directives. A normal day would consist of somewhat planning the night before, but everything would change in the middle of the night. Go through, we had a list of everybody's needs, start scoping around in country, find out who had what. We have a house that's got a lot of storage space, so we would actually, load up the truck. And when IMC was over, an International Medical Corps, when they're a volunteer group, when they were over at the General Hospital, they were hurting pretty bad a lot of times because they had their warehouses, but they were just not conveniently located. And with traffic and everything, it could take half a day to get a truckload of supplies, whereas we could get there in 20 minutes. So it would be anywhere between 2 to 3 supply runs a day to the General, 1 or 2 a day to Medi-Share Hospital, maybe 1 a day over to Adventist Hospital, plus all the clinics and everything like that. And in addition to that, we'd work in patient transfers.
So supply runs of?
Medical supplies, IV tubing, gauze, IV fluids, whatever they desperately needed. They'd call us up, we need this, this, and this, certain medications, everything like that. And we would just track them down and find them and get it to them. One of the more memorable nights that we had was, it was a major storm, and we had all communications had been knocked out, phones weren't working, internet was down throughout all of Port-au-Prince, and the only thing that was working was the data packages on the Blackberries and Facebook. And we got a Facebook message from Ann Lang, who is a volunteer over at PIH working at the General, stating that at midnight they were going to run out of oxygen, and at midnight they had to decide who's going to live and who's going to die. They needed 10 tanks of oxygen immediately. We called around, and Adventist Hospital could give us 8 tanks. Told them, you're getting 8, you have to make it work, nobody dies tonight. Little Paul, myself, and Lauren jump in the truck. We head over there with Ralph, our translator, and the storm was so bad it had cleared, blocked off the roads and everything, to the point we couldn't get through. So we had to turn around. We went to the General Hospital because we were going to get a driver and a couple of ambulances and load that up. We get there, and it's a complete onslaught of patients. We ended up transferring that night 8 women to Hospital Chancerelle, which is it's an OB/GYN hospital. We term it the baby factory. We ended up taking 4 orthopedic patients to, well, we were going to take 4 patients to Medishare Field Hospital, but their generators had caught fire and we had to help evac the hospital. So we took those 4 over to MSF Holland. And then we had 3 babies that needed incubators that we got transferred out to St. Damian's Children's Hospital. All that, and we still hadn't got the oxygen. So we're scrambling around the ambulances, LP's in the truck, little Paul, he's in the truck, and we finally got the oxygen from Adventist Hospital in an ambulance and got it there by about 10 minutes to midnight. So yeah, it was a crazy night. So financially what happened initially was little Paul and I, we paid for everything out of pocket. We pretty much bankrupt ourselves helping out. My car's been repossessed. I think both his trucks are gone. I got evicted from my house. I think I lost everything because my roommate, I don't know if she put it in storage or not. Little Paul's homeless as well. So we were basically paying for everything out of pocket, took all of our savings, took everything, dumped it into what we're doing, begged, borrowed money from everyone we could, and that's how we started operations. We were running on, we were living on the roof of the hospital of CDTI Hospital for the first 4 weeks until the hospital closed because of lack of funding. So we were in tents on top of the roof of the hospital. After that, the hospital closed down. We had to find a place. We found a house. We'd already started to get a little bit of money in from people on the ground that had heard about what we're doing. So we pinched and saved every penny we had. And now we have the house at the compound that we're at. And our expenses are about $10,000 a month. And that keeps our entire operation running of little Paul, myself, 5 Haitian volunteers, rent on the house, food, fuel in the truck, communications. I mean, that's no salaries. That's just day-to-day operations. We're financed through private donations at this point. We've been getting a lot more media exposure, and through that we've been able to get a lot more donations. We're working on finding some grant writers to really get in there because our plan is to implement an EMS program and a 911 system because there isn't one. And at this time, little Paul and I and the pickup truck we have are the Port-au-Prince 911 system.